Welcome to This Explainer. Your heart beats roughly 100,000 times a day, pumping nearly 2,000 gallons of blood. It is an absolute powerhouse. Today, we're taking a deep dive into the mechanics and management of this incredible engine for when it starts to struggle. We're talking about heart failure. If you're looking to understand exactly how the heart works, why it falters, and what modern medical science is doing to tune it back up, you are in the exact right place. Let's get into it.
Okay, let's dive into this. Here is our roadmap. First, we'll decode what heart failure actually is. Then, explore the types and root causes and learn how to spot the warning signs. From there, we'll cover diagnosing the condition, taking control with treatment options, and finally, living a longer life.
First things first. When you hear the words heart failure, it sounds incredibly scary, right? It's totally natural to ask, wait, has my heart actually stopped beating? The answer is a resounding no. Honestly, the term failure is a bit misleading. It simply means the heart is not working as efficiently as it should be. It hasn't ceased beating, it's just struggling to keep up with your body's demands.
Section 1. Decoding heart failure, mechanical breakdown.
The clinical definition of heart failure is a chronic medical condition in which the heart is unable to pump blood effectively enough to meet the body's needs. Think of the heart purely as a muscular pump. Its whole job is to continuously supply oxygen and nutrients to all your organs by pumping blood to your lungs and the rest of your body. So the crucial point here is that in heart failure, this pump has just become weak or stiff. It's definitely still pumping, but just not effectively enough to get the right amount of oxygen-rich blood where it needs to go. Now, people often confuse heart failure with a heart attack, but there is a distinct difference between the two. A heart attack is an immediate plumbing emergency. It's a sudden blockage of blood flow. It's a very acute event. Heart failure, on the other hand, is a long-term weakening of the heart muscle. It's a chronic, ongoing condition, but crucially, it's a manageable one.
Section 2. Types and root causes where the pump fails.
Now, what's really interesting about this is how the physical location of the heart's failure directly dictates where fluid backs up in your body. If the left side fails, which is actually the most common, fluid backs up into the lungs. That causes breathing difficulty, a cough, or pulmonary congestion. But if the right side fails, the fluid backs up into your body tissues, leading to swelling in places like your legs, ankles, or abdomen. And congestive heart failure? Well, that's a combination of both left and right-sided failure, causing pretty severe fluid retention across the board.
We can also break down the mechanics by how exactly the pump is struggling. Systolic heart failure means the heart cannot contract properly. The squeeze itself is weak, which leads to a reduced ejection of blood out to the body. Diastolic heart failure, however, means the heart muscle has become super stiff. It literally can't relax and fill properly with blood before the squeeze. So you're either looking at a weakness in the squeeze or a stiffness preventing the fill.
So what's causing all this mechanical wear and tear over time? Some culprits are strictly medical, like coronary artery disease, high blood pressure, or residual damage from past heart attacks. Things like cardiomyopathy, heart valve disease, and diabetes also play a major role. But lifestyle and genetics are massive factors too. Advanced age, a family history, smoking, obesity, and a sedentary lifestyle, all of these put prolonged, unnecessary stress on that central pump.
Section 3. Spotting the warning signs? Daily symptoms. Because fluid is backing up and your organs just aren't getting enough oxygen, everyday symptoms are going to start appearing. You'll want to watch for shortness of breath, especially when you're lying flat, or a persistent cough at night that might produce a frothy sputum. That's the lung fluid we talked about earlier. You might also feel general fatigue, weakness, and just a reduced tolerance for exercise. Remember that right-sided backup? That shows up as swelling or edema in the legs or abdomen, which can lead to sudden weight gain. You might even notice a rapid or irregular heartbeat as the heart tries its absolute hardest to compensate.
However, some signs mean the pump is in critical distress. These are non-negotiable emergency warning signs. Severe breathlessness, chest pain, fainting, rapid and worsening swelling, or sudden confusion. If any of these occur, it means you need urgent, immediate medical care at an ER.
Let's move to and see how this builds into an official diagnosis. Section 4. Diagnosing the condition. Confirming condition.
Doctors follow a very clear, step-by-step journey here. It always starts with a detailed medical history and a physical exam. Next, they'll order blood tests, specifically checking your BNP levels, and a chest X-ray to look for that fluid buildup. But step 3, that is the gold standard, the echocardiogram. This is absolutely the most important tool because it measures the heart's actual pumping efficiency, known clinically as your ejection fraction. Finally, they might run a stress test or an MRI for a much deeper look at the heart's underlying structure.
Section 5. Taking control, treatment options. An incredibly common question patients ask is, can heart failure actually be reversed? The honest medical answer is that while some specific causes, like hypertension or valve disease, can improve a lot with targeted treatment, most cases of heart failure are not fully reversible. But, and this is a big but, they are highly manageable. Early treatment prevents the disease from progressing and beautifully manages the daily symptoms.
And this brilliantly illustrates the game plan. To tune up the failing engine, treatment follows a logical three-step escalating approach. 1. Essential lifestyle changes. 2. Targeted medications. And 3. Advanced treatments and devices.
Let's quickly decode this pharmacy list. Every single pill here has a specific mechanical job. ACE inhibitors and ARBs, they relax your blood vessels to improve overall function. Beta blockers literally tell your heart to slow down, significantly reducing its workload. Diuretics are your water pills. They remove that excess fluid backing up in your lungs and legs. Aldosterone antagonists step in to reduce severe fluid retention. And digoxin is specifically used to improve the heart's actual pumping strength. Basically, they all work together as a team to make the pump's job a whole lot easier.
Now, when lifestyle changes and pills aren't quite doing enough, doctors have some amazing advanced hardware and surgical options. Devices like a pacemaker can strictly control the heart's rhythm, while an implantable cardioverter defibrillator, or ICD, actively prevents sudden cardiac death. Structurally, surgeons can perform heart valve surgery or a coronary bypass to fix the plumbing directly. And for the most severe cases, a full heart transplant is a very viable, life-saving option.
Section 6. Living a longer life. Habits for success.
A huge piece of your long-term success is cardiac rehabilitation. Think of this as a specialized personal training camp specifically for your cardiovascular system. It provides supervised exercise programs to help rebuild your endurance safely. It includes vital education on disease management, diet counseling for low salt and fluid restriction strategies, and real emotional support. They'll even teach you breathing exercises and energy conservation techniques so you can maximize your daily life safely and confidently.
The ultimate takeaway here is clear and, honestly, really reassuring. Heart failure is manageable. By catching it early and managing it proactively, you greatly improve your survival rate and you prevent scary downstream complications like kidney failure, liver congestion, or sudden cardiac death. You are directly protecting your quality of life.
As our source material powerfully summarizes, heart failure is a serious condition where the heart cannot pump blood effectively. With early diagnosis, proper medication, lifestyle changes, and cardiac rehabilitation, patients can significantly improve symptoms and live longer, healthier lives. It just perfectly encapsulates the balance between acknowledging the seriousness of the disease while also recognizing the incredible power of your own proactive medical agency.
Which brings us to the end of our explainer. Since things like a sedentary lifestyle, a poor diet, and smoking are massive risk factors, I want to leave you with this final thought. What habits will you build today to protect your heart's pumping power for tomorrow? It is literally never too early to start preventative maintenance on your engine. Thanks so much for learning with me today, and I'll see you in the next explainer.